start the work session, Monday, September 20th. We have a quorum at noon. Just note to the room, and those people will be, this meeting's going to be recorded. And looks like the first item on the agenda for the work session is a public hearing. If you look in your packets, you will see that there's one item on new business in the public hearing, which is rezoning of the former Allegheny Elementary School from residential to business transitional. This will be an opportunity for public comments as well. And we'll see that play out on Wednesday. I don't see any old items on the agenda here. So we're going to talk a little bit about new items. First we'll reference the new items that are listed on the Commissioners meeting. It looks like a review of that ordinance rezoning again will be there. And establishment of CPACE, but I don't think we'll be taking any action on that. Is that correct?
No.
Yes.
What I do have though is just, I need to know if it's okay to send that letter to all the municipalities. Because we won't be able to pass the resolution yet.
Hello.
Hello.
Hi, Ben.
Hello. Who's up there?
Excuse me?
Who all is there?
Jeff and myself, Pam Maffey, Lisa Hagbert, Josh Cotton, and Ken McCorson. So we just took a look at the public hearing agenda. There's one line item on there which relates to the rezoning of the Allegheny Elementary School. So there's more to come on that on
And
Wednesday.
we'll need another CDBG hearing, but probably not this one, because that'll probably have to be the following meeting.
That's a good question.
She's not ready for the second public hearing yet.
Okay.
Okay.
That's good. We do have a number of resolutions there, but so I'm assuming that those resolutions referencing the CDBG program and budget are okay to,
Yes,
Okay.
the one that is in your packets, 3190, is no longer valid.
okay?
So the other ones will be renumbered.
So that's gonna come off the agenda then?
Yeah.
Okay. Alright. And then we have CPACE. Is that going to need to be a resolution, or, as I think we have to give notification you were referencing to the townships and municipalities?
We have to send the letter, so the resolution will then go on October 6th.
Okay. And so we have some adoptions of the government policies and procedures, and those have been circulated. So I guess we'll need to make sure we review those, so we can take a look and make a decision what we want to do on Wednesday. It looks like the agreement with Trinity Food Services is out there.
Have we heard anything about the PIMIC setup?
I have not heard anything about the PIMIC setup.
Nathaniel's got to write the ad for the paper so that we can advertise the ordinance.
Oh, that's right, that's right. Okay.
Did you say Trinity is back on the agenda?
Yes,
It is, yep.
So Lisa and Nathaniel are both comfortable with it?
Yes, yes. We've gone through the agreement and, so has Nathaniel. We've gone through the numbers and vetted all the information about staffing and food costs, things like that.
And then I think the only, just ask the attorney. I think there was some questions or regarding termination notice and renewal. We're talking about the Trinity Food Services item that's going to be before us. Wasn't that your only outstanding concern is the termination requirements?
I think that's just contingency planning, that wasn't reason that I would withhold my disapproval
Okay.
from the agreement.
Okay,
Yeah.
all right, sounds good. What else do we have here? Policies and procedures is the next item in the work session, which will come to the commissioners, some of those on Wednesday, along with the resolution. Projects. I know, Jeff, you've got a project here that you were looking for support on.
Yeah, so, with the increased cases at the hospital for COVID-19, mixed with the concern over our low vaccination rate in the county, I'm recommending that we use a portion of the American Rescue Plan funds in order to do a vaccine promotion campaign. I put together a budget for it for everybody to look at, and I realized that at the state level and at the federal level, they've done a lot of different campaigns in order to, kind of promote and instill an interest, acceptance in the concept of vaccination. I think that those have kind of run their course, and I think that we need to do something locally that's going to utilize local leaders, community members, not just in the medical community, but other people in leadership positions in order to promote vaccination in the county. Until we're at a state where we have a majority of folks vaccinated against COVID-19, it's going to continue to be an issue in the county. All of the information that we have indicates that. I think that there are a lot of people that would be interested in being a part of a promotion in order to try to push the concept of vaccination. In this case, what I'm asking for is $22,784, which is just the part of this budget that was put together. This again would be from ARPA funds. It includes ads in the Warren Times Observer, inserts that can be handed out, radio advertisements, even we probably might replace Forest Press with maybe the Quarry Journal, and then Facebook and Instagram videos and ads. And so part of this would be, as for instance, we would take people who are in leadership locally, who are willing to speak on behalf of vaccination and its positive, positive elements of it, do video interviews with them, have them speak on camera in favor of vaccination, promoting it to people. Part of it would be billboard ads, potentially down the line, or like I said in the advertisements, having pictures of people that are promoting vaccination, and again, trying to have a local angle to it that isn't just kind of a stale discussion over vaccination. I think that the hospital has done a lot and done everything that they can do to promote it through their medical director and the ads that they've run, but I think that it's time for everybody else that's in a leadership position in order to try to promote this. So that's it.
Okay, that's fair. Yeah, and, Warren General Hospital had reached out to us and asked for a number of things, one of which was, doing something as a promotion, and secondly, looking for opportunities to have testing clinics as the cases continue to rise. So, anything else we have going on? I know we've submitted the NTIA grant for broadband in coordination with Youngsville TV Blue. I'm not sure which entity it was.
I'm not sure what the name is now.
Yeah, so anyways, so that's out there. I'm gonna touch base with Bill Gallagher later today to talk a little bit about Zeno Media and Verizon, so any new news there, so. Ken, do you have anything to update us on at all?
Just to let you know the status of the testing clinic at Warren State Hospital. AMI will be here at 2 o'clock this afternoon to start doing their setup. They'll start testing at 7 o'clock tomorrow morning. They have to end by 3 o'clock in the afternoon because the samples need to be delivered to the Philadelphia area, to the lab, before the lab closes. Those samples are taking anywhere from 24 to 48 hours presently at the current volume before the results come back. Results both positive and negative come to the tested via email. And the only concern I heard from Warren State Hospital is as we push this out to the community, that we let them know that the state hospital doesn't have anything to do with the testing, doesn't have anything to do with the results, that please don't call the state hospital because they really aren't involved in this process. They're just providing the space. And I think it would be wise for us to say the same thing about the county, that we don't have insight into positive or negative testing or anything of that nature. But I'm meeting them at 2 o'clock at the Israel building, and I guess more to come as we progress forward there.
Okay.
Media packets, they should have something to us by the end of the day for a media packet, and I'll make sure to get that to Josh and Erie News Now and those folks.
Sounds good. Sounds good. You heard anything about the census at the hospital at all? Guessing not.
From what I understand from the most recent meetings I've been in, that I can't speak to COVID census, but I can speak to room availability, and a lot of the regional hospitals are near or at capacity.
Okay, just in general.
Yes.
All right, and then we did walk through all the items in the upcoming commissioners meeting. I think I've got internal meetings on my calendar with a high-end board meeting tomorrow night at 8 a.m. So that's schedule. Any department committee updates? We did. The department that's here. Anything else?
So I apologize for beating a dead horse, but I guess my question is can I get this promotion plan at least on the agenda for Wednesday so that we can discuss and vote on that?
Yeah, I think that's fine.
Okay. Because I mean, we'll need to have a vote in order to approve the funding,
Mm-hmm.
so.
Right.
And I understand that this isn't an easy topic to discuss on here, and I apologize for that. It's not my intention to,
Well, I've had some overwhelming support from people in the community asking how they can help, whether to circulate, the benefits of the vaccine, and really also the experience that they had when they did get COVID. So I think that, I've heard that more than once, that they wanted to try to find a way to help the public understand, a little bit more about the disease and how things could go terribly wrong from a health perspective, so.
Do you think, did you say Warren General Hospital will help with the creation of these, or that?
yeah, I mean, my view of it is that everything we would do collaboratively, not just internally, but with Warren General and the medical community, so that everybody's comfortable with everything that's being shared.
Yeah.
It's not going to be my creation,
Right.
so it's more of, I've had numerous people requesting this, and they want to help, this type of funding would allow them that ability. So there have been several people who are videographers who that have volunteered their services in order to do, videos, interviews, the whole nine yards. So I think that there's plenty of folks that would be a part of the process.
But I think from the hospital's perspective and the region, we would want to get what factually is happening, in the hospital as it relates to hospitalizations and COVID. So.
Yeah, I just, yeah.
Yeah, it's I'm gonna be Dr. Jeff. So, that's not what I'm proposing. Nor would I wanna do that. So.
All right, anything else? Schedules to talk about, anything from your perspective, Ben?
I'll be, in Wednesday onward. My mother-in-law comes in tomorrow, so I'll be freed up a little more. So that's schedule-wise. The only other project that I'm working on, put on your radar is the Economic Development Summit that I mentioned a couple weeks ago. You should have gotten an invitation from Aaron Green, who's graciously volunteered to come help us with it. October 21st in the afternoon at Penn State Barons is the location.
You said Eric Green, is that what you said, Ben?
Yep, Aaron Green should have sent you an email. Mhm. Obviously, if COVID causes us to need to go virtual, we will, but
Sure.
most of the point of the thing is to network commissioners and economic development folks from across, well, not just Northwest Pennsylvania, but also Chicago County, Ashtabula County, et cetera. So I'm pretty optimistic. We've gotten a lot of good RCP back already.
Good. Great. October 21st, I'll check my calendar. All right.
Well, I did want to mention, so next Wednesday was the Knox McLaughlin class, the classes on continuing education for elected officials. I know we talked previously about going to it, but it conflicts with budget on the calendar. Did we come to a conclusion on whether we were going to go to that or not?
I thought we weren't because of the budget. That was my
Okay.
thought, that I thought we had come.
Schmitz is
That could be
a
additional.
Ben, I could go.
Okay.
I didn't RSVP, I'll say that, so.
It's a good event, I've got some issues.
I think if any one of us goes, it's fine. So if Daniel, you're going to go, that's great.
Send me the info. Send me the info and I'll.
Okay.
And you can box up some food and bring it back for us, right?
Yeah. That is one perk.
Bring it back, I have a little tickle in my throat.
I don't have court, I have a generally open schedule this week. I think I have some department meetings here around the Wednesday meeting, that's it. So,
All right, anything else for general discussion? All right, I don't believe we have a reason for executive session, do you? Either? Okay.
In 2 weeks, I'd like to be the next work session, right?
That would be in 2 weeks,
I should check the
in
dates.
October 4th.
Yeah, so I was hoping that I could do, Phil Gilbert and I could do a presentation on land banking. And it's something that I need to talk to you about in the interim.
okay.
Just because we've been talking with the RDA for a while about it. It was something that we had kind of started putting together as a part of the redevelopment task force, but we're kind of ready to present on a concept. So I'd like to do that at the work session.
Do we have any similar rural counties like us that do have a robust program of land banking?
Well, Lawrence County has a wonderful land banking program. There aren't that many. The last I checked, there's 25, maybe 27 out of 67 counties. So it's not that common, but the ones that I've seen, they do, I mean, it's a relatively new concept in Pennsylvania, so, but like in Lawrence County, I mean, all of the stuff that they're doing is through the land bank, and they're offloading a lot of, blighted and, properties and repositories, so, I think that if we set it up right and we can get the school board and others on board, it would be a way also to help fund the RDA and their continuing things, because the more properties they transfer, some portion of the taxes are allocated back into the program, so it would make it a more functional organization. And the good thing is that there isn't much that you have to do, at least initially, because of the change in the law. You can just turn the RDA itself into a land bank.
Okay, so that's in 2 weeks.
So in 2 weeks, yeah, I wanted to state that, and put it on the agenda, that way I know there's a deadline, and we'll definitely have it finalized,
I'm
but
trying to think of the date.
It's a calendar.
I think it's actually Tuesday, the 12th.
Yes.
The 12th.
of October.
Yeah. We're at, Northwest County Commissioners Association on Monday, the 11th.
Oh, you know what, that's gonna work, because I'm gonna be here. Alright, well then we'll do,
I guess we did change that, didn't
yeah, we'll
No,
do,
we just canceled.
The next one will be the 25th of October.
okay, so I'll just write 25th.
I'll have to check with Paul. I don't know if he didn't let me know whether or not they would be ready, because they were supposed to present today.
Right. Right.
we? Who's
Well,
How about I'll just coordinate with you, Pam, and we'll figure
Yep.
out everything.
That sounds good.